Hello there, I'm Peter Tabbins. I'm the MPP for Toronto-Danforth. We're waiting another minute or so as people come in from the waiting room. Our panel is all here, they're ready to go. We've got a very substantial registration. We want to just give people another minute or so to get in, and then we'll get going. And I want to thank all of you who've joined us this evening. It's really wonderful to have strong participation in these kinds of events. It's a big issue, a lot of people concerned about it. I know that you're going to have a lot of questions. And just another minute or so. I noticed people are raising their hands in this setup. If you want to make a comment or raise a question, please post to the Q&A. The chat function is being used by us panelists to coordinate things, and we actually don't have the raise hand function that allows me to see people wanting to speak. So please make your comments and your questions in the Q&A. And it's 7:33. We've got over 150 people already on board. So I'm going to get going and we can roll from there. Oh, I should just note, people can turn on the closed captioning on your screen so that you can see a printout of what's going on. Well, welcome everyone. Thanks for attending this evening. As I said earlier, I'm Peter Tabbins. I'm the MPP for Toronto-Danforth. I'm going to start off with the land acknowledgement. We acknowledge we're hosted on the lands of the Mississaugas of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and Inuit peoples. And I want to add that land acknowledgement is a good thing, but what we also need is concrete action for reconciliation in this country. The purpose of tonight's meeting is to fill people in on what's happening with legislation, to hear from the front line, to hear from the public, to discuss ways that we can all push back. Tonight, we'll have an opportunity to hear from a panel of experts, and you'll have time to express your concerns, ask your questions. We'll also have a time to look at actions. And given the discussions I've had, people are very focused on what can we do to make a difference. Again, if you want to pose a question or raise a comment, please use the Q&A function. We won't be using the raise hand feature or the chat. So I'm going to start by introducing our panelists, and we have a good panel with us this evening. DJ Sanderson from the Ontario Nurses Association. DJ is a registered nurse and the executive lead provincial services at the ONA. Prior to his work at the Ontario Nurses Association, DJ worked as a frontline nurse at South Lake Regional Health Centre in Newmarket, where he was also serving as a bargaining unit president for many years, fighting for better working conditions for nurses and healthcare workers. We also have Natalie Mera. She's been the executive director of the Ontario Health Coalition for over 21 years. She's built the Health Coalition into the largest and broadest public interest group on healthcare in the province, representing more than 500,000 Ontarians in its network of more than 400 member organizations and more than 50 local chapters. And Dr. Vincent Lam, a practicing physician, a faculty member at the University of Toronto, and the medical director of the Coderix Medical Clinic. Currently, he's assisting with COVID-19 vaccination efforts at Michael Garron Hospital, Toronto Public Health, and Unity Health. And he's a resident of Toronto-Danforth riding. So I wanted to say just a few words before the panelists get underway. They'll be talking about what we're facing, what we need to do to fight back against Ford's attacks on public health care. I also wanted to speak, though, from my perspective in the legislature. The first thing to recognize is that Ford has been forced to back down before, twice on the Greenbelt, and frankly, I believe he's going to have to back down a third time as well. He backed down on his attack on the education workers last fall. He can be beaten. I'm not saying it's easy. I'm not saying it's guaranteed, but it's something that can be done. This battle won't be over in a month. It took a long time to build public health care in this country, and we have to be prepared for the long fight to defend it. Now, my panelists will speak to a number of things that people can do, but I just wanted to mention some that are very useful. Signing petitions. We'll send hours out, the one that I use at the end of the meeting, one I've been taking door to door in Toronto-Danforth, write letters to the editor, letting newspapers and other media know that you are interested in the issue, that the issue is alive. Join the Ontario Health Coalition. They have really strong messaging. They've got a good organization, and they're in the forefront of this, fighting this from the citizens' end. Demonstrations are going to be happening. Please come out, show with feet on the ground that you believe that we have to defend public health care in Ontario. Set up your own community group. Talk to your neighbors, talk to people at work. Decide that amongst yourselves, this is the time to stand up for public health care. If you already belong to a group, say a church, a temple, a mosque, a housing co-op, a tennis association, a union, get a resolution passed by that group and send it to the government. Send a copy to me so I know what you're saying. But keep this issue alive. Follow the issues. Just keep your eyes on the news. Make sure that you know what's going on, and make sure that politicians know that you know what's going on. And with that, I'm going to go to our panelists, and I'll start, DJ, with you.
Thank you, Peter. Good evening, everyone. As mentioned, my name is DJ Sanderson. I am a proud registered nurse and the executive lead of provincial services for the Ontario Nurses Association. ONA represents over 68,000 nurses and healthcare professionals across the province, and also 18,000 nursing students. I'm really glad to be here tonight with Natalie Mara and Dr. Lamb, and I want to thank Peter Talvins for hosting the event, and of course for inviting me to participate. It is so important that we come together and organize this fight back against Doug Ford's dangerous plan to privatize healthcare in Ontario. Let's be very clear. Ford has created this crisis in our public healthcare system. His own government's internal documents stated that wage suppression legislation like Bill 124 was going to directly lead to retention issues. They knew this, they proceeded anyways. The courts have spoken on the legitimacy of that legislation in Ontario, but again, he's taking us back to court, spending your tax dollars to fight that victory. Allowing private companies to profit off people's surgical care is not going to solve the staffing crisis that we're seeing in Ontario hospitals. In fact, this scheme is going to make it substantially worse by pulling highly qualified and skilled registered nurses, registered practical nurses, respiratory therapists, and other healthcare workers from the already depleted system. There are a number of reasons why we're opposing the privatization of hospital care in Ontario. Far beyond staffing, we know there'll be price gouging, increased costs to patients and the taxpayers, and there could be a disastrous impact on the quality of care and standards, as we saw in England when the NHS expanded privatization in 2012. Doug Ford said he's going to ensure that nurses and healthcare professionals to staff these new private clinics will not be poached from the public system. This is nothing more than a Ford empty promise. He has no plans to prevent this. Some of these facilities will be able to offer better working conditions, better schedules, as a lot of them won't be running around the clock, holidays, weekends, and the rest, and they'll be able to offer competitive wages. Private clinics are not subject to the wage suppression laws like Bill 124. This is going to lead to a direct draw of nurses from the public system. The government needs to respect healthcare workers and drop its appeal in the courts on Decision 124. Instead, Ford should be investing in public health and increasing staffing levels to improve working conditions in our public hospitals. Our tax dollars have already built the infrastructure needed to provide these surgeries. A lot of people don't know this, but most operating rooms sit empty past 5 p.m. or weekends. Everything is already in place. The facilities, the equipment, the processes, all we need is the right staff, physicians, nurses, respiratory therapists, and the like, to provide these surgeries. On costs, we know that patients are already being pushed into buying upgrades at these private clinics, costing them hundreds or even thousands of dollars on their credit cards to get the care they need. Access to healthcare in Ontario should never be based on your bank account, but rather based solely on your healthcare needs. The business model for these private clinics is clear: the lowest risk, the highest process, and getting these procedures done as quickly as possible. as these sorts of facilities are measured against our public system, which will be taking everyone else in the system with comorbidities and the rest, it's very clear to see that more and more funding will continue to flow to these private clinics, as their statistics will be better and their outcomes, because they aren't taking on the risks. At Shouldice Hospital here in Toronto, a private hernia clinic, which Ford loves to hold up as the example of private healthcare delivery, people are regularly turned away because they have other diagnoses, they may be deemed too high risk, or they're sent away to say, go lose some weight and come back. These folks are all left, filed back into the publicly funded system, which we know is stretched beyond the brink, and no one should ever be turned away for healthcare delivery based on any pre-existing conditions. Since his announcement, Ford has been asked repeatedly if these clinics will be charging the province more per surgery than it costs to deliver them in the public system. Both Premier Ford and Minister Jones have refused to answer this question every single time. The only incentive for private companies is profit. It's that profit that's going to come chiefly from our tax dollars and from these extras that they'll be selling people. Funding that should be going already into our already depleted system. For the last 5 years, Doug Ford has refused to meet and listen to frontline healthcare workers and listen to the solutions that we've been trying to offer to improve our public healthcare system. Now we know that is because he's determined to privatize the system and let private companies and his political donors profit off of your healthcare. We cannot let this happen. Ontario's public healthcare system is not Doug Ford's to dismantle and sell off to his corporate buddies. This is a lot worse than Highway 407 that we saw sold away under the Harris years. Our public healthcare system has been built up over generations and belongs to each and every one of us. The Ontario Nurses Association is working very hard, hand in hand with our allies in the labor movements and advocates like Natalie from the Ontario Health Coalition you're going to hear from. And we do thank you for inviting us here to hear Natalie speak, and Dr. Lamb, as we continue to fight for the investments we need into the public healthcare system. This plan to privatize hospital care is dangerous. That's the only way to describe it. It's dangerous and it needs to stop. Thank you.
DJ, thank you very much. Before I go to the next panelist, a reminder to all your participants, if you have questions you want to ask or comments you want to make, please put them into the Q&A. And when the panelists are finished, I'll start going through those questions and comments and assigning them to the different panelists. And with that, Natalie, I'm going to go to you next.
Thank you, Peter. So with lots of affection and respect, thank you so much for the invitation to this meeting. I'm so impressed. Look, there's 190 people almost on right now. I think that speaks to the seriousness, the gravity of the issues that we're facing. I've spent the last 23 years of my career traveling across Ontario from town to town to town, and really learning about the values and priorities of people in communities. We fought for decades now to stop the cuts to local hospitals and the privatization of services. And what I learned was that everywhere across Ontario, people have spent the last 100 years or more building up their local public hospital system. In some communities, people refer to dying in their local hospital as dying at home. As opposed to being sent away to the nearest large city to die or to for the rest of their lives. These services are cornerstone services for communities. Our assessment of Doug Ford's announcement is that it is very serious indeed and of the utmost urgency. This is what he announced, just to make it clear for everyone for the discussion. He announced that they have already put out bids for 3 new private day hospitals to do 14,000 cataract surgeries initially, as well as diagnostics. They're giving tens of millions in new funding to expand private clinics to cover care for, quote, their words, thousands of patients. They say that they are substantially increasing and expanding what they call community-based clinics, which is a euphemism for private clinics, including more than 49,000 hours of MRI MRI and CT scans, 4,800 cataract surgeries, 9,000 other ophthalmic, so eye surgeries, 1,000 gynecological surgeries, 2,845 plastic surgeries. And then they also want to expand the number of private clinics and further expand the volumes in private clinics and hospitals. And then they want to move to expanding to other services like hip and knee surgeries by 2024. And so, you know, you get the picture here. Doug Ford said in the press conference that in the government's view, 50% of the surgeries in public hospitals are easy surgeries and therefore fit into the category of things that they want to hand off to these private clinics. Well, imagine if they are to take 50% of the surgeries and diagnostics out of our local public hospitals. That's a decimation of the local public hospital system in Ontario. It's also a choice and not a necessity. Ontario, every public hospital, large and small, has operating rooms that are closed for days or weeks or months at a time, even permanently, because for years they haven't had the funding to run them. I was in a town hall meeting on Friday night, actually, and a doctor from Toronto, from the University Health Network, one of the major hospitals downtown, was describing how operating rooms in his hospital stop running, a number of them at 3 p.m. because they don't have the funding. They haven't had the funding to run in the evenings. There's all kinds of unused capacity in our public hospital system. The Ford government has chosen now to take our public money, shift it over to build new private, essentially hospitals, and recreate that entire system, but now owned by private entities. That 98% of the existing clinics are for profit. So the vast majority of them will be for profit and operated then, owned and operated at our expense, but in the interest of private for-profit companies. We have just lived through the deaths of what is now 5,129 by the last count I saw the other day, people in long-term care from a preventable disease from COVID-19. The vast majority of them in for-profit long-term care homes that had death rates, you know, 3 times, 5 times the public and the not-for-profit homes. There is an utter difference in the quality of care, in the practice of providing healthcare when you have a profit-seeking company involved. We have seen this. The Harris government privatized home care, and it privatized the majority of long-term care. We have reaped the results of that over the last 2 decades. Now the Ford government wants to extend that to our hospitals. I just want to say a couple of things. There is no question in our minds. We have called every private clinic across the country and across Ontario 5 times. We posed as patients. We said we want to buy our way to the front of the queue. How much will it cost us to, you know, buy a surgery or buy a diagnostic test, whatever it is that they were selling? We caught the majority of them, not a small minority, the majority of them each time extra billing patients, charging thousands of dollars for medically needed surgeries and diagnostic tests. The prices were outrageous. For a shoulder surgery in a private clinic in Canada, right now, in the small number of private clinics that exist, literally 10 times the cost of the publicly covered health system. Cataract surgery, routinely 5 times the cost. MRIs, 4 times the cost. These are thousands of dollars. I just got a message from a person telling me about a friend who's a farmer in Weyburn, Saskatchewan, told that where they've privatized the surgeries and diagnostics in their province, told that if he wants to get a surgery in the public system, he'll have to wait for 1 to 2 years. He has no way of knowing if that's true or not. But if he goes to a private clinic and pays $50,000 for his day hip surgery in Canada, then he can get the surgery within a matter of a few weeks or a month or 2. And that is illegal, outright illegal in Canada. When we won public Medicare, we won the idea that there would never be a financial cost for access to medically necessary hospital and physician services. There is no question that this move poses an existential threat to the future of public Medicare in Canada and to the protection of patients from extra billing, selling them all kinds of medically unnecessary add-ons, charging people when they're elderly, when they're sick, when they're least able to pay. And we are going to have to fight this, or we will lose our single-tier public Medicare system. I don't speak like this lightly. This is, I think, the most serious threat in my career that we have faced to our public healthcare system. And we're asking everyone to join in the fight. There's a role for everyone. We can win. We've stopped this before under the Harris government. We stopped the privatization of cancer treatment. We stopped the privatization of MRIs and CTs and surgeries. When the Wynne government tried to privatize the surgeries and diagnostics, we stopped them completely. We can do it again, but it will take a major fight back to do it. Thanks.
Natalie, thank you very much for that. I wanted to remind everyone out there who's participating that if you want to pose a question or put forward a comment, please use the Q&A. When we finish with the panelists, I'll start going through those questions and comments to get responses and answers. And now, Dr. Lamb.
Hi, thanks very much for having me here, Peter, and really thank you very much to my colleagues for your perspectives. Incredibly important. I'm a physician in Toronto, and I spent 13 years working as an emergency physician. And now recently, I've spent the past decade working in addictions medicine, both of them in frontline clinical roles. And I have a few criticisms of the process and the framing by the current government. And I'll share some of that criticism, although with previous governments as well, because I think what we're really dealing with in terms of the genesis of the problem is we're dealing with a failure in terms of planning and forecasting, and that in conjunction with a very simplistic treatment of procedures as a consumer good, and a simplistic consumer good that can just be purchased as single units to somehow magically solve a problem. And that's not really the way healthcare works at all. So when I talk about a failure of planning and forecasting, we can look at the example of, say, orthopedic procedures, elective orthopedic procedures like hip replacements and knee replacements. We know the demographics of this country. We know that a certain percentage of people in certain decades of life require these surgeries. So it really shouldn't have been a mystery to Doug Ford when he took office, or to previous liberal governments who came before him, that there would be surgeries required, and it should have been quite possible to forecast. And so I think what we're looking at now in many ways is just failure to simply forecast predictable events. And so then the response to that is to treat it as a consumer good, and to say, okay, well, if we can just buy these hip surgeries by buying clinics and buying doctors, then all will be well. And I don't think that it's nearly as simple as that. Some of my colleagues have already alluded to some of the unintended consequences of this approach, and I'll just flesh it out a little bit more. So there are a lot of unintended systems consequences, and I'll sort of take you a little bit into the mind of many specialists, and this is particularly true of surgical specialists. Surgical specialists typically work in a hospital, and typically there's a part of their job that they really enjoy doing, and a part of their job that they really would rather not do. And the part of their job that they really love doing is operating, right? So for many surgeons, their perfect world would be a world where they could just operate and then send the patient off and let someone else deal with everything else. So deal with everything before the patient comes to the OR and after the patient leaves. You know, I may be slightly exaggerating, but I can assure you it's not much of an exaggeration. The part of the job that people really don't like is people don't like being on call. As DJ pointed out, people really don't like taking care of complicated, difficult patients with tricky problems, because those tend to not go as well, right? And even in the government's assertion, they are explicitly saying that they intend to sort of siphon off the quote low risk procedures and leave all the tough stuff in the hospital. Well, what that will mean is that lots of surgeons will just, as has been pointed out, say, well, you know what, I'd rather just go to a clinic where I can do low risk procedures. Why should I duke it out in the hospital and have to take call and be all up, all hours of the night dealing with actual medical emergencies? I'd rather just do nice, tidy elective procedures. So the unintended consequence here, right, is that there's no way that what's being proposed will actually address the crisis in hospitals. It will worsen the crisis in hospitals. So I worked for 13 years in an emergency department. I never had my emergency department bed locked or stuck or completely overloaded because of a lack of elective procedures. What I had was emergency departments that would be bed blocked and overloaded and stuck because specialists were not available, for instance, to take care of their patients following surgeries. So this will be a foreseeable problem because we will have people, as has been mentioned, incentivized to do easy stuff and disincentivized to actually do hard, tough healthcare. One of the other things that we don't think through carefully enough is that because healthcare is not just a consumer good, right? We can't just assume that every additional scan and every additional procedure is a worthwhile procedure. When private clinics are incentivized to make money by doing lots of these things, well, guess what? They'll just make money by doing lots of these things. But unnecessary imaging produces incidental findings that cause stress, that cause distress, that sometimes require additional procedures that have complications. And by just saying, look, the more you do, the more we'll pay you, doesn't necessarily mean that the right people will get hip surgeries or knee surgeries. Joint replacements are a great example of something where you actually want to choose the right time to do it. You don't really want to choose patients who are too young to do joint replacements because they only last a certain period of time. So you actually do want to delay until people are the right age to do the procedure because they only last a certain period of time. But if you're incentivized just to do as many as you can, then, well, guess what? You'll just do more. So I think the last thing I want to say is that there's a huge access and equity piece here, which is being ignored, because having access to healthcare is not just about some clinic existing somewhere where they want to charge you potentially extra fees. It's really about being plugged into the healthcare system. And our healthcare system is really centered around primary care. And people need universal access to primary care, I would argue, far more than they need expedited access to elective procedures. That's a hard problem. And maybe this government really isn't well suited to dealing with hard problems because they're not dealing with that, which I think is actually the starting point for improving healthcare in this province.
Dr. Lam, thank you very much. I want to say to the three panelists, you went over time, but what you had to say was so interesting that I couldn't stop you. So I'm going to go to the questions, and you may want to be a bit briefer on answers so we get as many in as we can. One question sort of off the top was, how many nurses, doctors, paramedics are we short, and how many are leaving or joining in the next 5 years? So what's going on with the workforce? My suspicion is that Natalie and DJ may be the best equipped to answer that. So which of the two of you would like to take the first step at it? DJ?
I think that was a point towards me.
Oh, yeah. No, I picked up the subtle clue.
Thank you. And I'm not exactly sure on paramedics and physicians and the rest, but I can speak to nurses that Ontario has had the lowest nurse to patient ratios in the entire country, coast to coast, for a very long time. And as we start, before COVID, when we were really starting to see the impacts of Bill 124 and the like, we guesstimated that we were about 4,000 to 5,000 nurses short. Because so many are opting for early retirement or leaving the profession altogether, that number has grown exponentially. And as much as we hear about internationally educated nurses coming in, it's still not enough to fill the gap. So I won't go on too long, but I can clearly give you that information about the nursing profession.
Okay, thank you very much. Natalie, we've got a lot to do to fight back against this. Could you give us a sense of what the Ontario Health Coalition is planning to do to fight back against this push for privatizing our healthcare system?
Yes, and just very quickly, I think we're estimating 34,000 in long-term care, nurses and PSWs that we're short, another 20,000 in hospitals for nurses. We don't have total numbers on docs or paramedics. It's very, very sizable, and there's no plan. There's zero plan to actually deal with that from the Ford government. It's actually shocking how little that they're actually doing on that. So any notion that they're sort of creating a crisis or doing nothing about a crisis or making it worse in order to do this, you know, it's sure, I never say stuff like that, but it sure looks like that, you know, to me on what to do. Well, we need to build a fight back that is commensurate to the threat. And it's really very serious. So our plan is to call a province, we'll hold town hall meetings first across the province, local protests. They're going to bring in new legislation to do this. The legislature reconvenes February the 21st. So they're going to bring in, we expect in that first week that they'll introduce legislation. So obviously we'll protest that. They have a majority. So we'll do everything we can to stop it and try and get out the message. We'll need to fill the galleries at the legislature and very seriously show opposition. My sort of dream is when they did this in Alberta, they tried to bring in legislation to privatize the hospitals. People drove in from across the prairie. And I remember Shirley Douglas, daughter of Tommy Douglas, describing that you could see, you know, because it's flat and you can see down the prairie, you could see lineups of cars coming into the legislature to protest. That's the kind of thing that we're going to try and build. But ultimately, what we'd like to do is build towards a referendum. Like as DJ said, you know, this doesn't belong. Our public hospitals, we built them for 100 years. We funded them. We tried to bring services closer to home. It does not belong to them. It's not theirs to privatize. And actually, until Mike Harris, we had legislation that required a referendum if you privatized public services that belong to the people. So we thought, well, we'll call a citizen called referendum and we'll hold voting stations across, you know, all across the city, all across towns across Ontario. We'll hold workplace votes and in as many workplaces as possible. We'll do online voting and mail-in ballots and try and get, you know, 1 million or more votes to stop the privatization of our hospitals. I think we can do that. So the plan would be to do that by late spring. We're holding a like kind of a major Zoom meeting like this to put together the plan with people across the province, not tomorrow, but next Tuesday. And I'm not quite sure how to share the link, but I'll share it with the organizers here if people want to join. And then there's rules for everyone. We need to get like local coffee shops and, you know, pharmacies and convenience stores and so on, get voting stations outside of them, have volunteers staff them at the ballot boxes, have people like Peter to count ballots, do things outside, can sit offices, like every place that we can get that's a high traffic area, so we can get as many votes as possible and just, you know, swamp them with the public opposition to this. We think that could actually, that would shake any government if we could get 1 billion votes, and that would stop it.
Okay, thank you very much for that. Again, a reminder to all of you participants that if you want to make a comment, pose a question, please put it into the Q&A. I have a question here. Do nonprofit hospitals have a set OHIP billing fee billed to the Ontario government for standard procedure like a hip replacement? If so, is there a corresponding OHIP billing fee set for private for-profit clinics for the same operation, and is it the same amount? I'm not sure who would like to take that. Natalie, would you like to try on that first?
Yeah, the private clinics get both, like the billing fee plus a facility fee and a physician fee on top. When the health minister was asked, are they going to pay the private clinics the same amount as public hospitals for the same surgeries? She ducked the question. She was asked like multiple different ways. And every time she ducked the question, she wouldn't answer because actually very likely more expensive. And we know on it, in addition, they bill patients on top for the same procedures. Like when people go and they're paying $2,000 for their cataract surgery in a private clinic, that clinic is very likely, almost certainly billing OHIP as well. So they're double billing.
Okay, thank you. Here's a question. So far, Trudeau's only comments on Ford's plan is that it is, quote, an innovation. Can we pressure the federal government to make any additional funding conditional on its use exclusively in the public system? Dr. Lam, would you like to try that one?
Sure. Well, I don't find it innovative at all. I find it, again, to be this utterly simplistic concept. I mean, we have had this duality, which has been uncomfortable at times in Canadian healthcare, where we have a universal payer, and we do have many services which are operated by private entities, right? And many of you may have a family physician who works in a clinic like this. And they're not for-profit corporations in the sort of business-oriented way that you think about it, but they're private entities who are paying for rent, paying for overhead, paying for salaries of staff, and billing the government, a universal public payer, in order to run essentially a small private business. So that has been the model for a long time. There are certain advantages. For instance, it's very flexible. People can sort of customize what they want. And there are lots of disadvantages. And some of the disadvantages are the great difficulties associated with planning. No one really knows how many family doctors are providing family medicine in Ontario or this country. Staggering, but true. No one really knows. And that's in large part thanks to this peculiarity of our private public, where we have public payer for certain things that are privately run. So that's kind of always been one of our knots to try to untangle. And this supposed innovation is just tying that knot tighter. It's just saying, oh, well, let's do more of this thing, which is sometimes really dysfunctional already. So it's not innovative at all. In fact, it's, I would say, the opposite of innovative.
Okay, thank you. Does anyone else want to speak to that one? Okay, I'll note here as a follow-up question, it appears the federal government is now coming on side with Ford to do this. How do we ensure that the Canada Health Act, which appears to be our biggest protection, is implemented in favor of concerned citizens? Does anyone want to speak to that? Natalie?
I don't want to take up too much space, but very quickly, right now we need to fight for it and actually bringing these in. We need to slow him down and stop him from actually bringing these in, because once they're in, it's going to be very hard to get them back out again. But we do actually need that. What Trudeau said the other day was just, it's like the worst that they've ever been on this issue. And very, very worrisome indeed. And we kind of have this collusion between these conservative premiers, you know, in the West, and Alberta, Manitoba, Saskatchewan, who have all been moving to privatize their hospitals, and then in Quebec as well. And so it's, you know, they're demanding more money without strings from the federal government, and they're all moving to privatize. So very, very worrisome. And so we're going to have to push the Trudeau government as well. I think we got to wait. I think right now it's hard to try and mount massive campaigns with multiple targets that, you know, are effective. So I think right now we need to try to do our utmost. It's year one of the Ford government. We need to slow them down. We need to get the rural communities and so on, that it will lose every surgery remaining in their public hospitals to this. And, you know, their patients are going to have to drive all over to giant cities where they're already completely overwhelmed, right? To try and get these services and all of that. We need to mobilize everywhere in every way that we can. But then we also need to take on the federal government. Enforcing the Canada Health Act after they've privatized the hospitals is, you know, a thankless task. And we've been trying to do it for years in provinces where they have done it. The most effective campaign that I saw was a seniors group in Quebec called the Réseau de something or other. They brought a writ of mandamus, which is a legal mechanism to force the government to uphold its own legislation. They brought one against the federal government for failure to uphold the Canada Health Act in their private clinics that were extra billing all over the place. You're charging patients thousands of dollars, and they forced the federal government to actually crack down on Quebec, and Quebec ultimately passed legislation banning the ancillary fees. A bunch of the clinics stopped operating and so on, because it is their business model to do that. And then it crept back in again. So you have to keep redoing it. It's like the for-profit long-term care industry. You win inspections and then they lobby and get them out, and then you got to win them again. But that's what's going on there. So we could do something like that after we try and stop Ford from bringing them in. If we lose and they're in, then we would do that. And in the meantime, we will send an open letter to Trudeau. Just shame on him for doing that.
Okay, thank you. I've got a question here. What happened with the privatization of the NHS, the National Health Service in the UK? I don't know, DJ, if you'd like to speak to that, but certainly the big nurses strike in Britain right now in response to the absolutely appalling conditions that they're dealing with speaks to some of the fallout with the National Health Service in the UK. Would you like to speak to that question?
Sure. Thank you. And yes, it has been all over the news, the issues going on in the NHS with nurses striking for respect and pay and better working conditions and the ability to provide decent patient care. One of the things that we've looked at was, I guess there was a national study done in England when the NHS expanded their privatization in 2012. And what they found was there was a direct correlation between increased wait times, patient satisfaction increase. A lot of people think that it'll be an American type system of, patient satisfaction, like a customer service type thing will be through the roof, but no, patient satisfaction significantly decreased, and treatable mortality worsened. Researchers found that there was a direct link between over 557 treatable deaths that were all related to privatization. So I don't have that actual report right in front of me, but that study is very clear that a lot of the issues that their government at the time was saying, this is what we're going to solve with this scheme, it in fact achieved the exact opposite.
Thank you for that. I have an interesting question here. Ford has said he would pay to help hospitals run their MRIs, but our local hospitals don't have MRIs and have to raise the $50,000 on their own. What good is this, as it may take years to raise this money? Dr. Lamb, would you like to speak to this about infrastructure and what's available and what's not?
I'm not an expert on MRIs or imaging costs, so I wouldn't want to wade into that. May I share an anecdote on the previous question about the NHS?
Yes, absolutely, please.
So and this is an anecdote, take it for what you will, but I was speaking to a Canadian intensivist, and I won't share his name because he doesn't know that his anecdote is going to be shared right now. And he went to spend some time, senior intensivist, to spend some time at a hospital in England. And in this hospital, they had a private area and then the publicly funded area. And as has been described, in the private area, they would do low risk, basically easy joint replacements and elective procedures. And he described it as a place where they had Royal Doulton china and very, very, nice food and nice linens and so on. But then whenever the patients would run into trouble, because inevitably some percentage of these, easy patients do run into trouble, they would then be transferred to the adjacent public hospital, right? And so his observation, which I thought was quite correct, is that in effect, what you had at that point is you had the public system subsidizing the private system, because it's all very well and good to say we're going to have this private system in the English case. And to be clear, I think that England is further down this road than we are right now. But it's fine to say that you have this private system where people will pay for things. But if the system doesn't actually cover the full potential cost of people getting very sick and needing very intensive medical intervention. And you then need to shift quickly from the private consumer-oriented system and shift that patient into the public system where the public pays. Effectively, the public system is now subsidizing the for-profit system to a degree that is increased even beyond the original costs.
That's it right there in a nutshell.
Yeah, it is there in a nutshell. Okay, what is the most effective way to reach out to decision makers in regards to this issue? What is the most effective action to be taken to stop this? And I throw it out to the three of you, whoever would like to go at that one first.
Actually, I know Natalie's has a lot of stuff in the works, but if I could just touch quickly on that last CT question or the MRI question, I believe that
yes.
happened in Orangeville at Headwaters Hospital, which is right in the Minister of Health's riding. And, you know, Peter, as you were saying in your introductory comments, you know, it's so important to stay on top of the news and follow what's actually going on, because that did look like a great grand announcement. The minister was there, a number of the hospital executives were there, they got a bunch of the staff to come out and they spoke about this great funding that was going to be there for imaging, CT and MRI. But they actually left out of the entire speech, they're not buying the machine. They're only going to provide the funds to run it. So that community is now going to have to raise that money. And the hospital is going to have to raise that money to purchase that machine before that even comes to life. So, you know, I know there's a certain amount of political spin that you have to wade through with this government, but that to me is, well, that's quite an omission. So sorry, I know, Natalie, we'll let you talk about some of the great things that the Health Coalition has coming up.
Well, what's the most effective, I think was the question. And I mean, at this point, for sure, government MPPs, all MPPs need to hear from constituents on this. So like, absolutely call in, email in, send in your message, you know, opposing the privatization of, you know, our vital hospital services. Please do. And don't think it doesn't matter. It totally matters, because those issues that MPPs hear the most on, they know it percolates to the top of the agenda for them. They know it's a touchstone political issue that matters and so on. All of that helps a lot. And this is a very dangerous political move for the Ford government. Remember Ralph Klein? I don't know if many of you remember him, but he was the conservative premier in Alberta who brought in the private clinics back then. He actually imploded the Calgary hospital. It was the big sort of macho, you know, we're going to bring down the, you know, we're going to, you know, bring in this revolution and so on. And so this was the mid 1990s, and the first governments, he and the Harris government, right, where they were the first governments that really just decimated the public sphere and tried to privatize everything and so on. Anyway, they brought in the private MRI CT clinics, and the Friends of Medicare in Alberta, that's our sister group there, they collected receipts from patients, thousands of patients that had paid for their MRIs, and they held protests. We held protests across the country supporting them, and they, you know, filled the gallery at the legislature. And when they tried to pass legislation, I remember seeing it on TV, the galleries were full. There were people hanging from the banisters in the galleries of the legislature. I mean, massive protests. And then they did this, I mean, the government did it, and then they collected all these receipts and they shamed the government and they forced them, ultimately the Klein government, into paying back all the patients that had paid for medically necessary MRIs and CTs. And then the Klein government rolled the funding into the public hospitals and away from the private clinics, and built the capacity in public hospitals. The Klein government reversed course on privatization. And they called it, he said famously, healthcare is the electrified third rail of Canadian politics. You know, you touch it and you get electrocuted. And that's our job. We have to electrify the third rail. We need to make visible the resistance. We need to make clear that this is profoundly undemocratic. They ran the election actually swearing up and down they would not do this exact thing. You know, we need to mount sort of democratic opposition where they're not giving us that opportunity, and we need to make it visible so everyone in Ontario knows there's a fight and they have some way of joining it. I mean, I think that's our role. And we just have to do the best job we can at it. And, you know, those things, if we're able to do that, there's no way that they're going to be able to bring this in, not without losing political power.
Thank you for that. I'm going to go to what may be the last question before we have wrap up comments. The question here that I'd like you, Dr. Lamb, to speak to. Andre Picard, who writes for the Globe and Mail on health issues and a number of other papers, usually defends the public health system. I heard him on CBC this morning saying he's unconcerned about Ford's move, that there's already a lot of privatization in healthcare. Did this surprise you? Dr. Lamb, how do you see this?
Yes, I must admit I was a bit surprised by Andre's rather blasé response to this, especially in light of a book he wrote, Neglected No More, which was really a damning critique of the privatized elder care system in this country. And if I recall that book correctly, I think one of his central charges was that we should really have a publicly run elder care system. So I think the explanation is that Andre just looked at this from a very good faith and rather simplistic point of view. The provincial government has said that they will not violate the Canada Health Act, and this will be all paid for by OHIP. They've said nothing about these additional charges or about extra billing. And so I think it's on that basis that Andre has responded to that, but without really thinking about the unintended consequences in the system, which we've discussed, even if there is no violation of the Canada Health Act to the letter of the law for the moment. And so I think that's really where Andre has just taken a quick glance, perhaps, and needs to look a little bit more deeply. One of the interesting proposals I do think exists is the OMA has proposed non-profit integrated ambulatory centers to deal with the surgical backlog. I think that is actually an opportunity for actual innovation. So there's nothing wrong with building another building as long as it's integrated into a system. So if you had integrated ambulatory centers, which were integrated with a hospital, so that people had obligations and relationships and a referral system with the hospital, and also integrated with primary care, so that you could actually bolster and assure people of equitable access, that would actually potentially be innovation. And so I do think that would be an interesting direction to explore.
Okay, thank you very much for that. We're in our last 5 minutes. I would ask the three of you if you could each give a 1-minute summary statement and some direction as to where people should be going on this issue. DJ, I'm going to start with you.
Great, thank you. And thank you again for putting this together and for inviting me to speak. And thank you to Dr. Lamb and Natalie. Your comments, they ring so true. I'm still focused on your comment, Dr. Lamb, about, well, and Natalie, I know you touched on as well, how the health system is centered. You're not going to see a lot of these private clinics open up in very rural areas of the province, which are already challenged to get the healthcare that they need for the residents that live in some of those areas. But stay informed, watch the news, join the Health Coalition. ONA puts out lots of information. You can visit our website. There's lots of ways to push back, but make sure your voice is heard. You know, call your MPP, call your MP, whoever you need to talk to, let them know our healthcare in Ontario is not for sale. Thank you very much.
Thank you. Natalie.
Thank you. Private hospitals were banned in Ontario in 1973 for good reason. And we have put all of our effort into building, you know, those particular services, hospital services in public and not-for-profit entities. There's no question that they're flawed, and in recent years have been allowed, even encouraged to become less democratic and so on. But over the years, we've won all kinds of public interest improvements, public access to information, quality of care committees, fiscal advisory committees, transparency, accountability in all kinds of different ways. None of that exists for the private clinics. And if we were to try and do what we've tried to do for the last 27 years in long-term care as the system was handed over to for-profits, we would find the same thing, you know, if they hand over the hospital system to for-profits. I really think that we, at our peril, allow them to change over the ownership and control of our public hospital system. In terms of innovation, there is no need for new legislation in order for hospitals to create special purpose buildings that do hip and knee surgeries or do all cataract surgeries. There's nothing to prevent that. In fact, that exists already in Ontario. The fact that they're bringing in new legislation, like, let's not get sidetracked or be naive about this. They're inviting bids and they're bringing in new legislation to privatize those services. And it's unfortunate that a bunch of the commentators are kind of mixed up about this, but let's not be naive. This is, you know, the Harris government privatized home care and long-term care, and now the Ford government is completing the effort by, you know, doing what the Harris government was not able to do and privatize the hospitals unless we stop them. Thanks.
Natalie, thanks so much. Dr. Lamb.
Thanks, Peter. I think this is a simplistic and politically motivated move, which is going to not only have limited benefits, but probably cause real harm to the healthcare system. And currently we have a system where in 2020, 1.8 million Ontarians didn't have a family doctor. Under current projections, probably 3 million, if trends don't change, will not have a family doctor in 2025. Those are hard problems. Those are the first problems that we need to address before we start to do things to try to win votes by buying a bunch of surgeries and a bunch of elective procedures. And we have to remember that we have a system where no one can really access any healthcare unless they have primary care. So whether that's primary care by family physicians or nurse practitioners, we really need to make sure that everyone in this province has primary care. That's actually our real challenge.
And thank you for that. I want to thank our three panelists for excellent information they presented this evening. I want to thank my staff who pulled everything together. They worked hard and I think they ran things well. And I want to thank all of you participants for being here. This is a critical issue. It's going to be one we're dealing with for years to come. And we have to mobilize ourselves to actually win this. We can't afford to lose it. I want to remind you that petitions are available. We'll be sending some out to you. I want to let you know that this webinar is going to be posted on YouTube so that you can access it and make it available to others who are interested in the issue. And we'll be sending out a package on that. I want to thank all of you for being here this evening. Hope you all have a good night and look forward to working with you in the years to come to win this issue. Take care.